Well, our Saturday series continues, Hormones and Menopause, What Makes Sense. Concluding this morning, we are going to be talking about hormones and PMS. PMS is a major problem for some women in the country, and here to help us sort things out are Dr. Kare Mahmud, an anti-aging and preventative medicine expert, and also Patty Silverstein, one of Dr. Mahmoud's patients. Thank you both for coming in. Patty, Dr. Mahmoud, good to see you again.
Thank you.
This is our fourth filing of this series of menopause, and we're talking about hormones and, of course, their balance. And we've been talking about menopause for about 3 weeks and all the different things to think about there. But now we're going to talk about PMS, which a lot of people do deal with each and every month, but at varying levels. And you were saying that 20% of women actually have some pretty severe issues when it comes to PMS.
That is right, and that's approximately 15 million women in the United States. So it's a very big problem that has not been solved.
And the issues that they're having, what are some of the major problems that are occurring with these women?
You see, PMS is mostly due to an imbalance between estrogen and progesterone. Either you have too much estrogen or too little progesterone. Estrogen and progesterone have certain opposing actions. Estrogen stimulates the brain, progesterone calms it. Estrogen stimulates the breast cells, progesterone matures those, and estrogen maybe retains some fluid, and progesterone is a diuretic. So when women have this imbalance, they have irritability, they've got breast tenderness, they get bloated and gain weight. Those are the typical symptoms.
And you said that when patients go into doctors, a lot of times they are prescribed antidepressants for these symptoms.
That's true. There's not much else available for this. In conventional practices, that's what they get.
Yep, and that's what happened to you. You went in, you had some pretty severe symptoms yourself, Patty.
Yes, I did. Mm-hmm.
And what kind of things were you dealing with?
I would just face irritability. I was kind of annoyed at a lot of different things, and I would get, I just was, crabby, moody, and I went into a doctor and he gave me antidepressants.
And you were saying that your husband, it was difficult for your whole family. It wasn't just you yourself.
Yes, yes. In fact, my husband said to me, you know, I should be the one they're interviewing. Yes, and the antidepressants did not help me at all.
Plus, what did you think when they prescribed those to you?
I wasn't depressed, so I didn't want to have anything to do with that. I didn't feel depressed. So, but I did try them, and it didn't help me at all.
So what have you done in your practice to help women with this issue?
See, when I got into these hormones, I reviewed a lot of scientific articles and books on the subject. I realized that there was this imbalance and that we needed to give these women some progesterone. However, progesterone, if you use that as a cream, doesn't get absorbed very well into the blood.
And if you take it orally,
and if you take it by mouth, it goes through the liver, and most of it is changed into metabolites. So it didn't make sense to me to have so many metabolites in the body, some of which could also retain fluid and salt, and that's already a problem with these women. So I came up with the idea of using a tablet under the tongue so it could get directly into the blood. And there's more to this method, but I'll tell you that of the 112 women that have used it so far, we had 63 women who had major relief and 36 women who had moderate relief.
And these are your patients.
And that's 88% improvement.
And so that's what you've been doing for just under 2 years.
Yes.
Is what you mentioned. And you have to do it just before your period, actually.
Yes, I take it 10 days before my period, and you put it under your tongue and it dissolves. And it's changed my life. Like I have no more irritability. I don't suffer from anything that I had before.
So then you're just mark it on the calendar, and it's that simple, pretty much.
Mm-hmm. Mm-hmm.
And so you continue to test levels to see what she needs, and your other patients, it's all different amounts of progesterone, right? And in the days prior as well, changes?
Yeah, it's from patient to patient depending upon their symptoms and duration of symptoms. And another, excuse me, benefit of this is that it's been shown that women with PMS have more breast cancer. And progesterone, real progesterone, been shown to help prevent that. So hopefully this will be another benefit.
And we were just chatting about your goal in coming here and talking about all of the natural hormone replacement therapy. Your goal here was just to get it out there so that more doctors think about letting women choose between the two.
Yeah, that's what I want to see, more doctors getting into this. You know, I can't take care of all the patients that are out there. So hopefully more doctors will get into this natural replacement of hormones for women. Women have been getting these hormones for the last 50 years, which are drug hormones and are harmful.
So, well, thank you so much for your information. I know there's been a lot out there. We appreciate, Patty, you coming in to talk to us, and I'm glad everything is going better for you and for your family as well. And for more information, of course, you can always contact Dr. Mahmud, as we mentioned throughout the last 4 weeks. The Innovative Directions in Health is located in each, and you can visit them by going to Kare11.com and clicking on the Saturday page. It's under News, and we'll be right back.